Hello, I'm Katie Adams with MedCity News, and I'm here with Dr. Ruben Amarasingham, the Chief Medical Officer at Smarter Technologies.
It's nice to meet you, Katie. Thanks for having me.
Yeah, thank you for chatting with me. I know that you have been focused on using AI to lessen the clinical burden for quite some time now. So I'd love to hear your perspective on where we're making progress in the industry and where we still have some work to be done.
This is one of the most exciting times, I think, in medicine. I've been involved with medical care for more than 20 years, and I think we're seeing kind of widespread, joyous adoption of some of these AI tools by clinicians, and not just clinicians, but physicians, nursing, increasing the case management, utilization management, so social work. So those have been very exciting to see, and I think everyone has seen some of the stats that have occurred, improving time for patient care, reduced documentation burden, all those, some anecdotes of clinicians saying, I'm going to practice for a couple more years and delay retirement. So we've never heard, I think in the history of healthcare tech, we've never heard of that kind of reception, organic reception and adoption from clinicians. So that part, I think, has been excellent. I think, health systems, provider systems, they still are operating with tight margins. And I think there's an increasing call for, those kinds of lifestyle metric improvements and improvements directly in bedside time is really important, phenomenal. But are there other kind of harder financial ROI that can be achieved? And I think that's going to be the next big step for value creation.
Yeah, you mentioned some of those anecdotes, and I hear that so often from health systems. Once they adopt a tool, especially a documentation focused tool, clinicians, doctors want to stay in the profession longer. They find that joy back in medicine. And I think, when we talk about deploying AI at a health system, you want that hard dollar ROI. That's great. But that softer ROI tied to retention and less turnover, I think can be huge for healthcare organizations.
Really good. Yeah. And I think that's probably harder to measure. Yeah. I think people are clearly feeling it. I think the time period over which that's demonstrated is a little bit harder for showing initial metrics. But I think we'll see in 3 or 4 years that organizations that have really spent time adopting it are going to experience really improvement on those fronts, which I'm excited to see.
You had mentioned that adoption is going really well, surprisingly well among clinicians, and this is something that more and more clinicians are comfortable using, integrating into their daily care. Can you talk about how Smarter Technologies has given clinicians the assurance that this AI is something that can augment your clinical judgment rather than completely replace your clinical reasoning?
It's a really important point. I think the worry that people are having is are these systems going to replace clinical judgment? So it's a great question. One of the ways that we're approaching it is these systems need to be very transparent about their reasoning. I think there's a term called black box, which is you don't really know how perhaps these AI systems are coming to their judgments. One of the remedies that we're really pursuing very aggressively at Smarter Technologies is very clear explanations of how did the AI come to this reasoning or rationale that's resulting in this kind of documentation or this kind of suggestion for a clinical condition. And so it would be the same way that if I'm talking to another physician, hey, I'm thinking that this person has acute and chronic heart failure. This is why. These are the things that have happened in the last 24 hours, diagnostic therapeutic tests. So I think that's really important. And so if we can recreate the way that we think as a physician back to the physicians, that's going to create a lot of confidence and ability to kind of check what the AI is saying and understanding whether it's real or not. And then the second way is this concept called human in the loop with AI systems, which is on our side, having physicians and others that are in the loop of the output so that it's not just pure AI, it's also clinicians. And there's a lot we could discuss there, but we're finding that for our partners, health systems, they're finding this to be one of the most important elements because they feel that there are clinicians that are watching their back as well. So those are the two kind of big approaches that we're taking.
I think so often in the conversations around AI tools for clinical documentation, we focus on the time saved, which is very important, especially when we're talking about the workforce crisis, the burnout crisis. But I think the AI can actually improve a lot of the accuracy and completeness of the clinical note as well, make it better. Based on Smarter Technologies user data, is that something you're seeing?
We're seeing dramatic improvements in that. I mean, it's not as though the physicians are not being complete, but they have, just think about it, they have a lot on their plate. I mean, they have multiple patients to take care of, let's say on the inpatient side, tons of details. They're trying to make sure that the work gets done for the patients, and
then going back to it. It's something hours ago.
Exactly. They're going back. They have other things to take care of. Things have evolved. So what we're finding with our technology, for example, let's take a note like the discharge summary. It's one of the most important documentation that you'd want to do for a hospitalization. It's important for the next doctor that's getting the patient in terms of outpatient. It's also important for understanding what happened in the hospitalization. And we're finding that the system is able to capture kind of nuances, additional conditions that were treated that may not have been written about, and therefore it's going to improve your case mix index, and it's going to able to tell the narrative story of what happened to the patient in the hospital more effectively, where ambulatory physicians that receive the patient are like, these discharge summaries are very helpful to me. So better transition of care support, more comprehensive notes as you've talked about, and really importantly to this ROI question, being able to capture the right billing codes and documentation of the conditions and activities that were treated, conditions that were treated, resulting in a more comprehensive note. So it's definitely true that we can get more comprehensive documentation.
Yeah, you're not paid for the care you deliver. You're paid for the care that you documented and coded.
That's right.
So I would assume there's a lot of missed revenue opportunities that a tool like this can uncover and unlock.
That's one of the, I think, the most exciting advances that Smart Technologies is bringing to health systems, is that we're generating a lot of net new revenue that would have been left on the table for these health systems. And, it's also important that it's accurate. It's not just about, documenting more so that you can get paid more. It's really getting accurately what happened in the hospitalization and then making sure that you're getting that revenue for that. So that's one of the most exciting results for our customers.
Awesome. Well, what advice do you have to your customers, to other health systems that are continuing to adopt new AI tools for documentation, for revenue cycle tasks?
Yeah. Well, one of the most exciting things that I'm seeing is that historically, revenue cycle and clinical workflows and clinical medicine have kind of felt like different entities in the healthcare system. And I think we're starting to see clinicians and the revenue cycle professionals working together to make the lives of these physicians and allied professionals easier, and also improve the kind of revenue cycle process and collection. I remember for many years practicing as an inpatient physician, it seemed like two different worlds. And so I think we're seeing with platforms like Smart Technologies the ability to bring those two together. So I'd encourage the health systems to bring the clinicians into the process, into the whole revenue cycle process, and the distinction between the clinical documentation process, what physicians are doing daily, and the revenue cycle process don't need to be distinct now. And that, I think, is very exciting. And then the second part is, to me, it's a profound moment in healthcare. I think we're starting to bring joy back into medicine, while also making it financially sustainable for health systems. And so I think health systems should definitely be exploring these technologies. I think there's enormous good that it can do, and it can help the lives of clinicians and improve the bottom line. So no time better than the present to get involved.
Well, as a doctor yourself, it makes sense why Smarter Technologies has this, obsession with the end user and really wants to bring clinicians into this experience.
Yeah, absolutely. It's been really exciting to see that.
Awesome. Well, thank you so much for sharing this insight with me.
Thank you, Katie.